Bladder function is one of the commonest areas of the body to be affected during this period of a woman's life. There's a wide range of symptoms which can occur, and some women unfortunately experience them all. Some just have an isolated problem. The commonest symptoms are urgency and frequency, which can happen both day and night. And obviously, if it's happening overnight, it can be very disruptive as far as sleep is concerned. Some women also notice a sensation of incomplete bladder emptying, and they may have a poorer urinary flow rate. They also experienced increased risk of urinary infections. And finally, some women also start to experience leakage. So that could be stress leakage, for example, when exercising, running, climbing stairs, but it can also happen involuntarily at rest. The main driving force behind the urinary symptoms is declining estrogen levels. So that has an impact in two ways. It impacts directly on the bladder itself, the bladder lining and the muscle, and also the muscle in the urethra, which have a large percentage of estrogen receptors, so don't work so well when the estrogen levels decline. But equally importantly, estrogen is vital for collagen in the pelvic floor. And that's one of the reasons that women at this period of their lives notice an increased risk of prolapse, vaginal prolapse, and sometimes the womb and bladder can drop as well. So you've got a combination of changes at receptor level, which affects the bladder directly, as well as a general laxity in the pelvic floor. And those two combined can mean that women can experience quite a considerable range of symptoms. Women who've had vaginal birth may escape symptoms for 10, 15 years or so after they've given birth, particularly if they do the pelvic floor exercises, which are key. But suddenly they then get hit with the declining estrogen levels from 40s onwards, and that has really detrimental impact on the pelvic floor in many women. So it can almost accelerate the aging process in that area, and that's when they first become symptomatic. Firstly, I would encourage anybody with these type of symptoms to consider HRT, either locally or systemically. Local estrogen can be a fantastic way of controlling estrogen deprivation in the bladder and the surrounding tissues, because the treatment goes directly into that area and passes into the bladder and surrounding tissues, so it can have almost an immediate effect. So you don't have to have systemic HRT to get bladder benefits, which many women find reassuring. There's also a wide range of other treatment options, including pelvic floor physiotherapy, which is absolutely vital. I would encourage all my perimenopausal and menopausal women who have any pelvic floor issues or bladder issues to seek help from a specialist physiotherapist. Even women who find it difficult to do pelvic floor exercises can actually do very well with specialist input. And finally, there are other options, bladder drills, which can help women keep control of their drinking habits, reduction in caffeinated drinks, timing their drinks, and so on. Again, specialist physiotherapy should be able to give guidance as far as that's concerned. So it's not really just looking at one particular thing to provide a cure, it's more looking at the overall impact that these symptoms have on a woman's health. I would actively encourage women to seek help from wherever they can with this group of symptoms, because the sad reality is that if they're developing symptoms in their 40s and early 50s, they will not improve as time goes by. Women who experience problems at this age, by the time they get to their 60s and 70s and beyond, will be really struggling. The key thing is to seek help, take action, have intervention before it becomes irreversible. Women do find it very difficult to discuss this issue, particularly if there's incontinence involved, with friends, with family. So sometimes when they see a specialist like myself, it's the first time they've ever brought it out into the open. And there can be a huge feeling of relief when they do that. I would reassure them that about 30% of menopausal women will experience urinary problems, so it's extremely common, and if they take action, they should be fine. The second question that women bring up is this it, or will it get worse? And women have this understandable fear that they may become completely incontinent within a few years of the menopause because of the sudden deterioration. Once again, I would reassure them that preemptive intervention is key, and they can actually stop the problem, if not reverse it, if they seek help.